Let's study something until you become a neonatologist. Today we will talk about something that is relatively common in the NICU. The neonatologists and the nurses are very well versed in, and it can be terrifying to parents when they first see it, but it is apnea of prematurity. This is one of the most common findings in the NICU, and it is more common the younger you are born. So the more premature you are, the more premature the brain stem is and the peripheral chemoreceptors are, so that regulation of breathing on your own doesn't happen the way it should happen in a term baby. So a lot of times if you see an apnea, what will then happen is the infant will have a drop in their heart rate or drop in their oxygen saturations. So how do we treat it? We will treat it with methylxanthines, which used to be theophylline, but now we use caffeine. Caffeine is essentially the same thing. It actually works a little bit better. It has less side effects and a longer half-life. So caffeine works by antagonizing adenosine receptors, which basically means it will stimulate the central respiratory neural output, aka help them remember to breathe. So babies that get admitted to the NICU that are born early typically will get a caffeine bolus, and then they will get maintenance caffeine daily. This helps to reduce the severity of the apnea and the frequency of the apnea. However, it can still happen even if an infant is on caffeine. And what fixes this is time. So the closer a baby gets to 34, 35, 36 weeks, the less likely these episodes are to happen. So the trial that looked at this is called the CAP trial, or caffeine of prematurity trial. And the authors actually found that caffeine not only helps apnea of prematurity, it actually has a greater effect on infants in long-term outcomes. Infants born less than 1,250 grams, that there was a reduced need for mechanical ventilation. It actually helped facilitate extubation, a decreased incidence of BPD, decreased need for PDA treatment, decreased severity of ROP, and it actually improved long-term neurodevelopmental outcomes in these infants. Hopefully you find that helpful, and let me know if there's any other topics you want me to cover.